Hello, I'm Senator Roxanne J. Persaud, representing the 19th Senate District. Today, on our conversation with Senator Persaud, that's me, I have a guest here, Shoshana Marder. She's the Executive Director of the LeapFund, and we will talk everything benefit cliffs today. As the Chair of Social Services, that's something that we're passionate about, and so today is our day to speak about benefit cliffs. So, Shoshana, welcome to our conversation today, and let's start by just introduce yourselves to everyone.
Yeah, thank you. And thank you so much for having me. It is such a pleasure and an honor to be here. I don't think I've been in Albany since high school. So it feels good to be back. Yes, it feels good to be back here. And really
Albany's
such
a good
an
place
honor.
to come.
It is. A little uphill walking here this morning, but otherwise it's been pretty good. And yes, I'm Shoshana. I'm the Executive Director of LeapFund, based in New York City, but we're working with organizations and people nationally. And at LeapFund, we're all about tackling benefits cliffs, which I know we will dive into plenty today. But a benefits cliff is basically for people who receive public benefits, earning $1 or $2 more an hour, but as a result, losing benefits worth a lot more than that. So people are earning more to ultimately make net less. And we work to provide transparency around these benefits so people can know as they're making decisions in their life, while also pushing for systems and policy change to eliminate these kinds of cliffs and decisions altogether.
That's good that you said that, because I'll talk about, for the past few years, I've had the legislation to do the task force on benefit cliffs and to see what is it that we need to do to eliminate those cliffs that people are falling off of. And it's been vetoed a number of times, and we've introduced it again this year, and we're hopeful that it will be signed. We have a lot of support across the state, and it's because it's something that everybody understands. It's something the state needs to get a handle on. Too often, as you said, $1 puts someone over that cliff, and they lose their benefits, and the salary increase that they're receiving does not counter what they're going to lose. And so some people, we've had this one corporation that tells us, they started looking at it when their workers were not accepting increases or not accepting new positions. And they're like, well, why not? You're a clerk, and then we're giving you an assistant manager position or something like that. And then people will say, oh no, if I'm making $5 more, I'm going to lose the subsidy I'm receiving to pay for my rent. But the money that you're paying me is not enough to cover what I'm going to lose. So what is it that you're seeing with the people who you're working with?
Yeah, and we work with a lot of different stakeholders. I think you highlighted so many important stakeholders already, right? You have the people who are receiving benefits who first and foremost are impacted by these cliffs. And not only are they being punished as they're trying to get ahead and take jobs, take promotions, get raises, but it's also the not knowing that really impacts these decisions. People don't know how a change is going to impact their benefits. So they're making really rational but fear-based decisions around their benefits and their career. And it's also employers, like it impacts their bottom line, their ability to attract and retain talent when people are afraid to take jobs and promotions. And I think that is what we're seeing on the ground, how much people are really trying to navigate these systems, and people are ambitious, and it's not a lack of ambition that's causing them not to pursue these careers or these opportunities, but it's really the system itself that's punishing them. Yeah. I think it's been really inspiring to see how dedicated people are and passionate and really are trying to find ways to work around it. But there's only so much you can do when you don't really know how changes are going to impact you. And as you're highlighting, like some of these impacts are so severe when you talk about losing your rent, losing your childcare, losing your healthcare. Like these are not necessarily risks that people can take with their lives. Yeah,
it's interesting that people say, oh, you're on social service benefits because you don't want to work. You want to depend on government. That's not true. The vast majority of people, social service is meant to be a stopgap. It's supposed to help you, give you a hand up, and then you're weaned off of it. But the way our system is set up, it's that we're helping you, but we're holding you back at the same time. Because if you're trying to move forward, the way our system is set up, it's like, you can't move forward. If you move forward, you'll fall off, and then you come back in the same system again. And we have to prevent that. Children people are telling their children not to apply for summer youth employment
Yeah.
because the summer youth employment funding that this child was receiving was counted against families, which made no sense. Right? So a child works for 2 months in the summer to make some money and hopefully to help their parents so they can buy their school supplies for the school year. But then the family goes for recertification of their benefits. They're like, oh, there's another $2,000 that's added to your income. And it's added as though this is money for the entire year. And I was like, sorry, you're going to lose benefits because your child made $2,000. Right. And so we did legislation to make sure that's not counted, which now, we're telling kids apply for summer employment and telling parents because they're still afraid of letting them do that.
Yeah.
It's so what is it that your organizations that you partner with, what do they tell the communities when they go out to speak with people?
Yeah, well, I think the first piece is really around transparency. So we partner with many stakeholders because there's so many stakeholders involved and impacted by benefits cliffs. Our signature program is our benefits cliff coaching program. So we partner with nonprofits, direct service organizations, and we train their staff in how to talk about benefits cliffs with clients. And what we really a big part of our program is that we never want to say this is what a person should do, and this is the action that a person should take because it's so individualized, depending on what their situation is.
Yep.
Their cliff is so personalized to them, like everyone's hitting cliffs at different points. But also, as we're saying, like what the risks are and what that decision looks like is so different. Like let's say someone is nervous that a raise is going to impact their benefits and they are able to use our tools and resources and discover, they're going to lose their childcare if they hit this cliff. Then that conversation of what comes next is so dependent on that person, what their situation is, what their goals are. Maybe they anticipate, okay, I'm going to get this raise, lose my childcare, but I know that I have another raise coming up in a year. So this is something I can withstand right now because it's putting me on this pathway. And I'm able to work out this loss right now while I'm on this pathway for this career that I want. And so maybe they decide to take that raise even though they know they're going to lose their benefit. Maybe for someone no, they can't afford to lose childcare. That's a huge expense. And it's like, how do I show up to work if I don't have childcare? So I think it's so personalized for each person, which makes talking about benefits cliffs a little hard. I'm sure it makes legislating around benefits cliffs also really hard because it's such an intricate system that is working together to cause these really intricate problems for people. Yeah.
And it is causing problems for people. Let's talk about SNAP because SNAP is part of the benefits. And we know all of the changes that have come about in SNAP regulations. What are you hearing from the people that you're working with about the regulations that are coming about?
People are really afraid. Organizations are really afraid of what this will mean for the clients that they're working with. Also bandwidth wise, how they're going to address these new work requirements for people and for the people that they're serving. What we're starting to hear is a couple of things. The work requirements, of course, like everything, are quite complicated. So it's not necessarily that anyone who is now has to abide by these work requirements. It's not that they're necessarily going to hit a cliff. There's a lot of way to kind of fulfill that requirement. But what it is doing is it's forcing these conversations now around work and benefits, which maybe were always happening, but it's really bringing these conversations to the forefront. So if someone is looking to fulfill that requirement and now they're thinking about work, maybe work in a new way, now this larger question of okay, what kind of job, how will my benefits be impacted, are becoming more relevant. And they're probably happening in places where they didn't happen before. And staff at these organizations have a need to have this baseline education in maybe a way that they didn't have before.
But we've also lost funding for the education component of when people were going out and speaking to folks about educating them on benefits. So SNAP Ed and all of, so we've lost that funding. So organizations have had to let people go. So if you're letting people go, how do we have the capacity to speak to the community about, the things that we need to speak with them about so that they're aware of the changes that are there?
Absolutely. It's right. Now, as we're making all these rules are just making life more complicated. We need more funding to now be able to abide by all these regulations, not less. And at LeapFund, we're trying to help specifically around benefits cliff education for staff. But I feel with a lot of our work, it's like, I love my job. I love the work that we're doing, but we're filling in a gap that should be done by the agencies, by government. This transparency that we're looking to fill in and provide, it shouldn't really be us that's doing it.
Right. Yeah, and it's going to be a tough time because the deadline is approaching quickly, when these changes are fully implemented.
Yeah.
And I think for the most part, there are people who are like, oh, it's not going to affect me until it really, and there's not. We've been sending information to the people who are going to be affected by this. And they're like, oh yeah, we'll wait and see. When we're talking about veterans who now have to prove that they're disabled, why does a veteran who's been deemed disabled have to now go back to the government and say and prove that they're really disabled, so that they would not lose their benefits? And those are some of the things that we're going to be struggling with in our communities, and we have to make sure we're speaking to people when we're going to senior centers. Up to 64, it's up to 64 years old, and then after that, you don't have to worry about meeting those requirements. But it's still a tough thing for people to have to navigate. We're going to the senior centers and we're talking with folks. We're going to the schools and talking with folks, letting them know, the best way to get information to households is when you go to the schools and speak to the children. Put something in their backpack and say, give it to your parent. And so those are some of the things that we have to do. So tell us also, the agencies, when you're speaking with the agencies, what's the conversation like?
Yeah, and it's been, when we started in 2018, we started first by talking to public benefit recipients, learning that not only were they facing these cliffs, but they just didn't have the information, which means they were making these fear-based decisions, and that, of course, was a policy and system failure. So we did a lot of work then talking to different agencies, and we try to continue having these conversations. I just want to say that because I'm like, I know it's been it's been a minute since we've connected with a lot of these groups. Initially, I think there was a lot of denial around whether benefits cliffs even still existed. I do think that's changed. I think, and I think just benefits cliffs in general are being talked about a lot more. It's such an honor to talk to you because I think this is something you've championed before it was popular, and it's so important. I think you've really led the work in this space. I think where it's hard, it's who owns this problem, because benefits cliffs don't just lie in one agency. It's how all these different benefits are interacting. SNAP, childcare, healthcare, is how they're all interacting together that cause these cliffs, which make it understandably hard for an agency to tackle, and also very easy to just kind of be like, okay, this is something we have to address on the state level or federal level. So I think that's been a challenge. I do think that agencies are aware of it, and at least trying in new legislation that is being passed to consider benefits cliffs. So as an example, when there was a lot of talk around raising the minimum wage, which is a very exciting thing, but then this question of, okay, but how are benefits going to be taken into account? I think those considerations are happening more than maybe they were happening 5-6 years ago.
Yeah, when we talk about the minimum wage, the federal government still hasn't raised their minimum wage in a gazillion years. And so people are still being penalized. And that's some of the things that we have to have a larger conversation on a national level about. It's when you're talking about benefits and people qualify and remaining within the guidelines, there's no one size fits all, right? And I think on the federal level, they're not conscious of that. They're just like, these are the guidelines we're giving you, and you have to fit. You got to figure it out. That's it. You got to figure it out. And if they don't qualify, they don't qualify. But if we work that way, there are many people who are going to go without food on the table, without childcare, without, as you said, without health insurance. Because they're not going to qualify. And so, because they're not going to qualify, they're not going to take whatever increases, et cetera, that they are going to get. And so the social service role is going to grow exponentially because more people are going to just remain on there.
Right.
And I tell people all the time, the social service benefits are not supposed to be for someone to remain indefinitely. There's supposed to be a timeline. Say, okay, you're starting here. We're going to help you along the way as you get yourself together, and then we're going to wean you off of that. And at 6 months, after you've been stabilized for 6 months, we start weaning you off gradually, and then you're off. Okay, but that's not what's happening.
Yeah.
That's not what's happening.
Right. The system it's counter to what the very system itself is meant to be. So I'm like, benefits cliffs. I know this is like a simple way. It's a really stupid problem.
Yeah.
It just
it's a problem we can solve.
A stupid and solvable, a solvable problem.
Yeah. So what would you say to government as to how we can solve this problem?
I wish I had a very simple answer. I don't, but I think, that's why the legislation, the Fiscal Cliff Task Force is so important, because there is some research that still needs to be happen and we just need to start doing and seeing how those changes happen. The way that we kind of break it out is into 3 categories around transparency, mitigating, and eliminating. So the first is, how can we provide more transparency around these cliffs? Because the impact of these cliffs, part of its severity is just the not knowing. And this is like a very easy solvable thing to do. It's like, we have this information. We know when people are going to have their benefits impacted. Like we just need to be able to share it so people have this information, can plan ahead. I think the second is mitigation. So how can we start to make this a little better for people, starting benefit by benefit, maybe population by population? I think the example you gave with the Summer Youth Employment Program is a great one of, this doesn't mean that family is never going to face a benefits cliff, but at least in this one program. Or the income disregard bill that you're also championed is a great example too of like, for TANF, for this population, we're going to make it, for this time period, we're going to kind of push off these cliffs. So this doesn't get rid of the problem, but it mitigates it so that it becomes more, slowly becomes more manageable for folks. I think on the eliminating side, that's where it becomes a lot more complicated, and it might require some significant changes to the benefit system and how these benefits interact with each other. But that's all. I think it's doable. Like, part of this is just math. Like, how can we make the math work so that it always makes sense for people to take a job? They're never punished for taking that promotion. So it might require working across agencies, but to me, this seems like a solvable math problem.
It is a solvable problem. So do you see one particular community more at a disadvantage when it comes to benefit cliffs?
Yeah, it's a really great question. I think we get that question around community and also from the workforce standpoint of like sector, like, is there one workforce sector that's most impacted? Not necessarily, because cliffs are so individualized. So it really looks different for each person and each household. Obviously, we're talking here about people who receive public benefits. I think we have been seeing it more with families, especially people with young children, that these cliffs can happen a lot then. In our work, we've seen it happen a lot with SNAP. I don't think that's necessarily that SNAP is the most severe benefit, but I think it's more reflective of just like the organizations that we're working with. That's where really most of their clients are receiving. So I don't know if there's a simple answer. I think similar on the sector side, I think employers are often really surprised that their workers are receiving benefits and that they're also potentially being impacted by the benefits cliffs. So I know that's definitely not a good answer, because it's kind of just, it can happen everywhere. But I think really highlights the severity of cliffs too, and just how far reaching it is for folks.
Do you see, we have this in social services also, this large homelessness population. And it's also, many of those folks are receiving benefits and have lost their benefits. Do you see, if we do not fix this benefit cliff issue, that it will continue to impact people's homeless, the unhoused situation?
Yeah, I think all of this is so connected. I'm thinking back to what you were saying before around minimum wage and just like the cost of living now. And benefits exist in most income brackets. I think where it differs for public benefits. And by that, we're defining as like SNAP and healthcare.
WIC and health. Mhm.
I could argue that like tax credits, mortgage tax credits
yeah.
are also a public benefit, but for this conversation, we're defining it that way. So I think these cliffs exist in all income brackets where they're different for people with low income receiving these public benefits. Is the stigma around it. So if you're a higher income individual and you're trying to perhaps avoid paying or want to lessen the amount of taxes you're paying, there's not that much stigma there around the steps you can take. And there's a lot of people out there that can really help you save a lot of money. We do not apply that same attitude towards people with low income. And the stakes are so high because when people no longer receive their benefits, even if it's because they're like getting this job or this raise, most cases they're still not making enough to survive. They still can't, like the cost of living is so high, they still can't pay for housing in some cases. So I think that's how it all connects and why this conversation is like really, really serious and severe for folks.
It really is. I was at a shelter one day and talking to some folks, and a person who was staying there, her and her kids, she actually works with in a social service agency, and she got an increase, but it was not enough to manage what her rent increase was. And what happened? She was no longer housed, and then she got a benefit voucher. Homeowners don't want to take the voucher, so we have all of these issues that are affecting people who are receiving public benefits.
Yeah.
But it's something that we have to continue talking about. And, it's not something we're going to solve today. But I think if we start by doing the task force and having the research done so that we can make informed decisions as to how to prevent people from falling off the cliff, it will take us a long way. So I just want to, as we're wrapping up, say thank you for being here today. And just tell the folks out there anything you want to tell them about LeapFund and, how to prevent the proverbial falling off the cliff.
Yes, and thank you so much for having me, Senator. Really such an honor to be here. What I will say is that if you're someone who's facing these benefits cliffs, or if you're an organization that serves people maybe facing this benefits cliff, please reach out to us. We're always looking for more ways to partner and looking for ways to really push up the stories of people who are facing this on the ground so that legislation like the one you're looking to pass in New York and nationally, we can really make this change.
How can they get in touch with you?
You can
or your organization?
You can go to our website, myleapfund.com, and reach out to us there.
All right. And you don't only serve people in New York City, you're serving across the state. Right?
Across the state and also across the country. So.
Well, thank you very much for being here. Thank you for coming up from New York City to Albany today for us to have this very important conversation on benefit cliffs. So thank you, everyone, for joining us. I'm Senator Roxanne Persaud, and it's been our pleasure. We'll see you next time. Have a great day. Thank you.